Hi, I'm Andrea. I'm one of the pharmacists for Strive. Thank you for joining us for another episode of Strive Sessions. Today I'm going to be talking about hair. It's amazing how often I'm asked about what can my patients do for their hair health. What we have to realize is for a lot of our patients, hair defines who they are. So when they start noticing changes in hair, whether that be shedding or lack of regrowth, it can oftentimes cause a lot of fear and anxiety. So we're going to spend a few minutes today discussing how we can support our patients and their hair health. As a disclaimer, this webinar is for educational and informational purposes only and is not intended as medical advice, diagnosis, or treatment. These statements have not been evaluated by the FDA. Strive compounded products are not approved to diagnose, treat, cure, or prevent any disease. The information shared is based on current literature and clinical experience. The information shared is based on current literature and clinical experience, but individual patient care should always be guided by a qualified healthcare professional. All right, let's dive into hair care. The first thing we need to understand are hair growth phases. By understanding the phases of hair growth, we can help to determine where we can support a patient. So the first is called anagen. That's the growth phase. It's what we call the active growth phase, where the hair follicle produces new strands. Now, the hair remains in this phase for an extended period of time, oftentimes 3 to 7 years, and our goal is to maintain and extend the anagen phase. The next phase is the catagen phase, which is the transition phase. This is going to be the shortest phase of hair growth, and it's the phase when hair growth slows down and the hair follicle begins to shrink. Next, we'll talk about the telogen phase, which is considered the resting phase. This is a period of time where the hair has stopped growing and it's resting in place until it sheds. The last phase is the exogen phase, which is the shedding phase. So this is when the old hair naturally sheds from the scalp and new hair begins to emerge, in which the anagen phase begins again. Now, when it comes to hair loss, it's important to understand the root cause. Get it? Root cause? That was supposed to be funny. There's many reasons for hair loss, whether that is androgenic alopecia, so hormones, nutritional deficiencies, thyroid imbalance, autoimmune disorders, medications, hormone changes. It could be stress, illness, or lifestyle factors. By determining what is causing hair loss, we can help support a patient better with hair growth. We're really going to spend a few minutes diving into hair loss during weight loss. A number of our patients are utilizing GLP-1 medications or other medications for weight loss, and patients often contribute their hair loss to the medication itself. Well, I have a secret for you. It's not necessarily the medication causing it, it's the weight loss. Semaglutide and Tirzepatide have an adverse reaction profile, and in that profile, hair loss is listed, but it is actually only listed at about 3 to 5% of patients will have the adverse effect of hair loss due to the medication. What we have to realize is that our patients that are utilizing weight loss medications, specifically semaglutide, tirzepatide, or other GLP-1s, are often losing 15 to 20% of their body weight. That rapid weight loss actually sends the body into a stress response, and that stress response for the hair is called telogen effluvium. That stress response causes hair to stop growing, going into that telogen phase, which then leads to the shedding phase. So while we think it's a result of the medications, it's actually a result of the rapid weight loss or the nutritional deficiencies patients have while they're utilizing the weight loss medications. Let's now dive into some of the medications that Strive Pharmacy compounds to help with hair loss. We'll start with some of our oral options. The first is cedar. Cedar is actually indicated for men. It has finasteride, minoxidil, plus biotin. Now, a small amount of biotin. Not all patients are deficient in biotin, so not all patients need an extreme amount of biotin. It's something to keep in mind. When patients are utilizing biotin, it can affect blood work. So about 2 to 3 days prior to blood work, it's great to have a patient stop any medication with biotin in it so it doesn't affect that blood work. Back to cedar. Cedar is indicated for men. Again, finasteride, minoxidil, those two are active ingredients that are going to help either with the blood flow to the hair follicles for hair health, or they're going to help prevent testosterone from converting into DHT, which is oftentimes the culprit of hair loss in men. Cedar's a great product. It's a tablet that is taken once daily with or without food. Something to remember with all of these products that we're going to talk about today is that consistency is key. They need to be taken for an extended period of time for these patients to see full results. While we talk about Cedar for men, we have Ivy and Willow for women. They are similar, but there is some age restriction on these. The reason for that is that Ivy has Dutasteride in it, which is not indicated for women of childbearing age. Willow has Spironolactone, which is going to be a better option for women that may be of childbearing age. Now, these work similarly to Cedar in that they have Minoxidil to help with blood flow to the hair follicles. They have a product that's going to help prevent any androgenic effects of hair loss, and Biotin as well. These are just taken once daily with or without food, and you will see that Ivy and Willow will be offered as tablets soon. That's a little secret between you and I. Our last oral option is going to be Hair Force One. That's right, I said it, Hair Force One, and now you won't forget it. Hair Force One is going to be a multivitamin intended for hair growth. It has vitamin C, zinc, iron, niacinamide, methylcobalamin, and again, a small amount of biotin. This is going to be a really great product that's going to help those patients who might have nutritional deficiencies while they are losing weight. This will become a great supplement for those patients. It's going to help with scalp and hair follicle protection. It'll help improve blood flow and help with nutrient delivery, as well as have collagen and keratin production, all things necessary for hair growth. There are a number of hair vitamins over the counter. A lot of them are so fantastic, but one of the things I do have to say about Hair Force One is that you will know exactly what your patient is receiving. There's no proprietary blends or whatnot that leave you guessing with what is exactly in the product. All right, next we're going to move on to some of our topical products. This is one of my favorites. It's called Vital Peptide Hair Therapy. This product is simply GHK. GHK copper is a peptide. This is an incredible peptide. It actually has the ability to help restart hair growth. It works in a pathway that helps to initiate the anagen phase, which again is that growth phase that we want to maintain for the longest time possible. GHK is also going to assist with scalp health. Having a healthy scalp will help maintain an environment that's necessary for hair growth. Here I talk about GHK as a topical product, but GHK can actually be taken orally to help with hair health as well. So something to keep in mind. Another innovative scalp solution that Strive Pharmacy compounds are both the men's and the women's scalp solutions. Now these are quite interesting. They have azelaic acid, liothyronine, progesterone, and then for women they maintain estradiol, for men they have testosterone. So these are interesting products in that they're going to help with the balance of hormones. So again, a lot of times hair loss is due to hormone-related issues. Azelaic acid can help prevent the conversion of testosterone to DHT. Estradiol is going to be necessary for healthy hair growth. Progesterone helps to maintain adequate hormone pathways. Together, all of these products are going to help with hair growth. They're going to help to increase the thickness, and they'll decrease hair loss overall. So these are going to be great products for both men and women to help support hair care. Next is Follicle Fix. Follicle Fix is simply Minoxidil and Finasteride. Those are probably the products that you've heard most often when it comes to topical hair care. These are going to decrease hair loss, help thicken hair, create stronger hair. The Minoxidil will increase the blood flow to the hair follicles, increasing the amount of nutrients that are delivered to the follicles. And Finasteride helps to prevent that testosterone from being converted to DHT, which again is a culprit in a lot of androgenic hair loss. Suggested use for the topical products are for them to be applied directly to the scalp in the area of hair loss. Always remember to wash your hands after utilizing these medications. One thing I will tell you, as we spoke earlier about cedar, is consistency is key. Patients may actually notice some hair loss before they notice hair growing again. Now remember, some of those hair follicles were in the telogen phase, and they have to go through a shedding phase before a new hair follicle can come. So it's important that patients understand that that shedding phase is okay, that it's natural, and that the hair should grow back in its place. Next is Raven. Raven's oftentimes used in men, and the reason for that is it does have finasteride. We don't want to utilize finasteride in our women of childbearing age. This product has a number of different active ingredients in it and is a great combination therapy. We mentioned finasteride. It has fluocinolone. Fluocinolone is a steroid that's going to help to decrease inflammation in the scalp, providing a healthy environment for hair growth. Minoxidil. We've talked about minoxidil a number of times, but I have a secret for you. Not everybody can convert minoxidil into its most active form properly. Not everybody can absorb minoxidil to its greatest effect, so we add tretinoin into this product. Tretinoin actually helps with the absorption of minoxidil into the scalp, and vitamin E for enhanced follicle health. Again, this is a solution that's applied once a day. Next, we'll look at Hair Revive. Hair Revive is very similar to Raven, but it does not have the finasteride in it. The reason that was taken out, again, is that finasteride should not be used in women of childbearing age. So instead, the finasteride was removed and topical biotin was added. So this is going to have a lot of the same benefits as Raven. Again, this contains minoxidil with tretinoin. So this product is going to be fantastic to use in your women patients. So our medications. I just went through a number of them. Now that's not all of them. So if you have a patient who is struggling with hair loss and we don't think that one of these is the perfect solution for them, contact your Strive pharmacist. We can help you with it. I will just review some more facts with some of the active ingredients. We spent a lot of time talking about finasteride. Something interesting is that azelaic acid is going to be another active ingredient that's going to be used in women more often, and that will help prevent the conversion of DHT. Again, DHT being the culprit in a lot of hair loss. Minoxidil, stimulating that hair growth due to vasodilation, increasing the blood flow to the hair follicles. Dutasteride. Dutasteride had that similar effect as finasteride, just used in our older women population. And GHK. GHK, again, is that copper peptide that is just so fantastic for so many different reasons. We've spoken about biotin, we've spoken about tretinoin, we spoke about fluocinolone and spironolactone. So you can see we have a number of active ingredients that are going to help patients in so many different ways. We want to either reinitiate that anagen phase or extend the anagen phase to help with continued hair growth. Now we just focused on a lot of different medications, and you might ask yourself, why choose a Strive product versus an over-the-counter product? Well, our products have been created by pharmacists. We've done a lot of research. We've done a lot of testing in the development of these products as well. The testing helps to ensure that the products maintain their potency over time. So while an over-the-counter version might sound wonderful, I will tell you that these products have been shown to work in a number of different populations. Now, while they work and they're great, there's always warnings and precautions. Minoxidil, Dutasteride, Finasteride, these are products that shouldn't be used in pregnant women, so oftentimes are avoided in women of childbearing age. Compounds containing tretinoin also carry that same risk. So please know your patient. Again, try to figure out the root cause of their hair loss, and let's work together to help maintain healthy hair. Thank you so much for spending some time learning about hair with me. Please stick around for a Q&A session. Put your questions below.